Well, plans for the IBX light rail service connecting Brooklyn and Queens is moving forward. That was just one of the highlights in the Brooklyn State of the Borough speech delivered last week to a standing room only crowd at the Boys and Girls High School.
Borough President Antonio Reynoso outlined an ambitious plan for Brooklyn, touching on transportation, public safety, health, and jobs. The Borough President joining us this morning to talk more about this. So great to see you.
So happy to be here.
Okay, standing room only. That
Yes.
means people really are interested in what you have to say right here. Let's begin with public safety and really the fact that you're zeroing in on specific areas, right, that lacked investments, Coney Island being one of them. But Coney Island's been a troubled spot for so long, right? So why do you think it was neglected, and what do you plan to do to help with the issues?
I think what ends up happening in these communities, we have our comprehensive plan. And what the comprehensive plan did is it outlines 5, I guess, symptoms of success. Let's call it that. And it's transportation, education, housing. So we added them all up, and then we just put them one on top of each other. We layered them, and we found out that there's 3 or 4 communities in our city that lack these 5 essential items to be successful and have opportunities. And Coney Island is one of them. And the issue is that to solve Coney Island's issues, we mostly focus on enforcement work. So it's adding more cops to deal with all the plight that's happening, all the issues that are happening. And we should be looking at these other 5 factors that not only increase safety, but also increase opportunity in these areas. But they have none of that. They have almost nothing that makes what Brooklyn Heights, Park Slope, and Greenpoint successful. Is not the amount of cops that they have, but instead these opportunity indexes, I guess, is what we would call them.
Right. Let's talk about childcare, because people want childcare, affordable childcare, and accessible childcare. This is a good fight that you have been fighting all over the borough, trying to save these childcare facilities. One of which you actually went to as a young child. You were successful in saving them for what, a year? But what happens after that?
We have no idea. I actually think that it's a ploy by the administration to not have anybody pay attention for the next 3 months while the campaign is going on, buys us a year, and now our focus and our energy and our ire and our concern will be focused mostly on October, November, and December as we get closer to the end date. But we bought a year, and it does buy us. Time is always on our side and is good. Also allows for whoever the next mayor might be to be someone that wants to ally with us and work alongside us to save the center for long term. We also talk about universal childcare as something that we want to achieve in the city. If we're closing down these centers, when that happens, universal childcare, the capacity to be able to put these kids in different areas is not going to be there. We're going to have to take 5 and 6 years to actually achieve universal childcare because we just won't have them. And closing these centers is a hint that this administration does not have universal childcare on its radar.
Yeah, what was the reason, I guess, they kept them open? Because if it can stay open until December, which is the end date. Why not keep them open for the remainder of the, what's the end goal here?
We don't know. We asked them, hey, if we have full enrollment, we negotiate a contract, we do everything we're supposed to do, are we good then? They said, we don't know. We'll revisit that later on in the year. Again, I really think it's about buying time so that we don't attack them during campaign season.
Let's talk about the Interborough Express, which is still in its planning stages. We keep talking about the Interborough Express here. How much relief would a light rail system like that bring to specific neighborhoods that are really transit deserts, right?
Yeah, and that's part of the conversation we're having with these layers of opportunity indexes. Do you know that most of the people that work in healthcare, for example, which is the largest employer in Brooklyn is healthcare. Most of them live in transit deserts. So we're talking about nurses and doctors and dentists, whoever it is that is working in a hospital lives in these areas. This IBX would allow them to connect to a major, not only the LIR, the L train from Bay Ridge, so they will also have access to South Brooklyn and also Queens. And it's just the interconnectivity is so important in this one area. And transportation is one of the leading causes of opportunity, I guess, advancement, is how close you are to those. It's in the budget right now. So in the budget, well, it's not in the budget technically. It's been proposed. I'm sure they come into the budget at the state level. It should arguably pay for itself. This is a light rail transit system that already exists. So we're not creating new infrastructure. We're just putting working carts in what is already a commercial freight line turned into I guess, a residential one or one for residents.
Right. Talk about those layers. Obviously, transportation, a big one, a huge one. Healthcare. This being Black Maternal Health Care Month and Week. You've made some big milestones, though, as it relates to women's health care and maternal mortality. Talk about the milestones, and then where do we go from there?
So our first year, we focused on giving the hospitals a ton of money. So we gave them $45 million to have state-of-the-art facilities, women's health units in the 3 public hospitals in Brooklyn, which are Woodhull, Kings County, and Coney Island. Sorry, South Brooklyn Health, they changed their name. And we did that. Then we had like baby boxes we gave to like 500 women. We gave baby boxes to newborns in Brooklyn, and we also did baby showers, community ones. So a lot of these people come from like North Carolina and these different places that they don't have auntie and their grandma. So we threw them a baby shower. It was a lot of fun. Now this year we're doing maternal health, mental health for maternal health. The majority of deaths that happen during for the childbirthing process or through pregnancy is actually mental health through suicides and overdoses. So what we're doing is we're going to start a class with Brooklyn College, a certification program in which you're not only going to be a mental health therapist or psychologist or somebody working within the field in and around pregnant women. You can take this and you have a specific targeted, I guess, talent to be able to speak to the mental health issues of postpartum depression and so forth.
Okay, good stuff. You also had some star power. Anthony Ramos.
Yes.
By the way, his music's fantastic. If no one's ever listened to his music, but you should listen to it. It's fantastic. But he was there to expose kids to the Bushwick Theater, right?
Yeah.
In Bushwick 2 Theater.
Yeah, so he comes to Bushwick, which is where he's from. He goes to his local high school, and he commits to $20,000, and I do as well. We match it. So we have $40,000 to a program that saved his life, that he believes saved his life, that I was actually defunded or didn't have the resources. So he comes back to his hometown, and it's a full location. It's beautiful, and he's able to recommit to helping people find what their artistic talents are.
Right.
And Anthony Ramos is just, he's just a regular guy. You go anywhere with him, you wouldn't know, and you know what he looks like, but if you didn't know what he looked like, and he's just there with his family, with his friends. He brought in a bunch of people from his past, and I can't tell you how grateful we are that he's from Brooklyn.
Yeah. Good stuff.
It's amazing. Great work. Thank you so much. Brooklyn Borough President Antonio Reynoso, always a pleasure to have you.
Thank you so much.
Thank you.